Hey, thanks so much for the opportunity, Dave. It's good to be here. Good to talk to you guys today. And I did just walk off the floor with some patient care. We had some high energy people this morning, so that was a good time as always. So I'm excited for you guys to be here today and do this course together. Obviously, in this 1 hour format here, I really hope I can share a lot of light with you on running and some speed things that have really helped me in my practice and helped so many clients. I want to try to keep it simple, obviously, in the time we have together, but hopefully impactful for you. So I'm excited you guys chose to come to a webinar like this and are listening in. It's not a specific webinar on anterior knee pain or Achilles tendonitis or low back pain or something like that. So I think it's always a different topic for people to jump on and say, like, is this something I need to learn about? And my perspective and my approach is that if I understand running mechanics and sprint mechanics and how that is an elite high-level movement pattern, if I understand that at a high level, I can break that pattern down and deliver it to my patients that are trying to return to marathon running or trying to return to sport or trying to just return to even walking. I can take a high-level pattern and break that down and use those tools. So I really hope that some of what you guys get out of this today, as maybe not that we get all of these drills and all of these specific corrective strategies, but think about the 30,000-foot view of what it looks like to run and how amazing that movement pattern is, what goes into that pattern, why people have pain in that pattern, and then, of course, how do we fix it at that point? How can we help them perform better? So that's what I hope to do with you guys today. So let's have some fun and get rocking with this. All right, so let's break down acceleration a little bit here. I want you guys to see this live, again, kind of at game speed to appreciate how aggressive this is. Acceleration is a very, very aggressive, very power-generated activity. So you can see the aggressiveness of which this athlete takes off. It's very, very rapid. It's big amounts of motion, okay? Now, this is obviously a linear athlete, but this is the same for every soccer player, every basketball player, every tennis player. When they go to take off and they go from a stop position or a slow pace and they go to run and accelerate, the mechanics are relatively the same. And we're looking to achieve certain angles. So here's an example. I broke down some film of this guy sprinting. You can see on the left picture, this is his acceleration angle. So this is coming out of a 3-point stance, which may not be normal in most sports, but if you're doing those sprinters, you'll see this. But the most important thing to recognize is the amount of lean. So look at that. He's greater than a 45-degree lean. So his lean compared to the ground he might be at a 30, 35-degree angle to the ground, which is incredible. If 90 was vertical, he's only 30 degrees up from 90. So this is very much a controlled fall. If he doesn't get that leg out in front of him very fast, his nose is going to hit the ground. And he's going to have some pretty good skid marks through the cheek there. It's going to be ugly. Okay. So some of the key things, absolute speed. This idea of terminal stance is huge. Can you get your foot out behind you? And then can you get that hip extended to get there? We got the nice swing phase where we got a big swing phase of the leg. In this position, the foot actually contacts out just underneath the body, okay? But you never actually hit the heel, all right? So in absolute speed or in running, when someone's actually running, not jogging, but running, there's really not going to be a heel strike. They should land at the midfoot position and maybe have the heel slightly touches the ground, depending on what pace they're running at. But for the most part, the faster they run, the less heel contact you're going to get. So if you take a concept like barefoot running, which I'm a fan of, so you say barefoot running's been, everyone's familiar with that at this point. It's been out and about. It's a good concept. The thinking behind barefoot running and these minimalist shoes is that if you hit your heel out in front of your body, it's going to hurt. So you'll stop doing it, right? So that's great. Totally true. Totally agree with that concept. The problem is if the person doesn't have the cardiovascular fitness or the mobility in their hips or their T-spine to run faster, then they're just going to shorten up their leg strength tremendously, and they're going to start to do midfoot contacts and still not really get that much faster or get much repulsion in their run, but they will stop heel striking in front of them. So that is a win. Okay, so there's a couple things to do that are a good tests that you can do here. These are probably things you're fairly familiar with and common with, but do a dorsiflexion wall test. Does your client have enough dorsiflexion to get the job done? So this would be put your toes up against the wall, keep your heel down, slide your knee forward, and if is your knee able to touch the wall or not? All right, so toes touch the wall, keep your heel down, bend your knee, can you go forward and touch the wall? Hopefully that's a yes. What you want to be able to do is touch the wall with your toes still 3 to 4 inches away from the wall. Okay, so the standard is 4 inches away from the wall or the width of your hands, which is usually about the same. 3 or 4 inches away from the wall. Keep your foot down, glide your knee together, forward, touch that wall. If you can do that, great, you check the box. If you can't do that, then we need to do some work to mobilize that ankle potentially, or that ankle joint or the calf, Achilles area, to get you that flexibility. Because if you don't have it, you're not going to be able to get in the right position to actually push off and achieve terminal stance. Or